Here's a story to get your teeth into. In an exclusive investigation, the Daily Mirror newspaper reports that up to 1 million Brits are unable to get an appointment with an NHS dentist, and some are resorting to ripping their own teeth out. The paper reveals a huge rise in so-called unmet need, with 1 in 4 adults either unable to get an appointment, languishing on a waiting list, or put off by long waiting lists and the cost. Another of those delightful consequences of lockdown that were unforeseen, apart from those of us who said it would happen. Trying to get a dental appointment during the pandemic was harder than getting an audience with the Queen. And we now have a legacy of 3 years of neglected dental health. And as you know, as well as I, whatever happens when you ignore problems with your teeth and you don't treat them early, you get problems. Mild sensitivity in a molar can, in a matter of months, become a large and dangerous cavity, sometimes too big to fill, once discovered, requiring painful and expensive labour-intensive root canal work. The government, the scientists and a largely uncritical media thought that drastically reducing health services for 2 years, with an NHS focused seemingly exclusively on one virus, was a price worth paying. You tell that to the 7 million people now waiting for treatment on the NHS. The public are indeed not happy, as confirmed by this graph, courtesy of the King's Fund and the Nuffield Trust. Public support for our National Health Service is at an all-time low. Why? Because for many Brits, you're more likely to win the lottery or knock Miley Cyrus off the #1 spot in the charts than get to see your GP this side of Christmas. And so the sorry tale of a COVID-centric NHS which prioritised the containment of a potentially nasty but largely mild virus over type 2 diabetes, cancer, dementia and other far worse illnesses is mirrored in our now wonky dental health services, which are in need of correction, polishing and straightening out. Of course, they cry for more money. Well, they probably should have thought of that before they smashed the economy into a brick wall, closing once viable businesses and paying healthy people to stay at home. This is all part of a wider picture of what, in my view, was the worst public health mistake in history. And as with so many other aspects of the pandemic, it's children who have paid the ultimate price, with kids suffering a litany of dental problems after 3 years of neglect. Now, thousands of kids can't even get on the books of their local dentist. This crisis of dental care is a prime example of our wildly underperforming public services. They were in trouble before the pandemic and COVID, but COVID was the straw that broke the camel's back. Dental services, like the wider NHS, need root canal and branch reform. It's time to extract waste from the system, drill down into those waiting lists, fill the gaps and deliver a service the public can smile about. For struggling Brits, this dental care crisis is yet another kick in the teeth. Now, what do you think? The government would argue that all of the COVID measures, including reducing access to dental services, was based on the advice of top scientists, and those measures saved lives and prevented the NHS from becoming overwhelmed. That is what they would argue. It's not my view, but what's yours? Mark at gbnews.uk.